I grew up in South Central Los Angeles. It was tough growing up. I was around like 6 or so when my biological dad left and didn't let anyone pretty much know that he wasn't going to come back. And just remembering how hard my mom worked to provide for us. She just taught us to be really hard workers. And so I made it a point to get a job to be able to help my mom with the bills and things like that. During that time, she actually had my brother, and he was born with Wolff-Hirschhorn syndrome. From what the doctors had told us at the time is he wouldn't live past 2 years old. He would never be able to talk, never be able to walk. And I was always there to be the interpreter and try to explain things for her and to her. And it just sparked that okay, I need to be a doctor, not just for my family, but for other people who are going through similar situations and they just need someone to help them understand what's going on. I was the first person to go to college in my family. I was a psychobiology major, and once I graduated from UCLA, I worked for a few years, and I ended up working at Kaiser Permanente. I was doing administrative work, and I thought I was happy because I was able again now to provide for my family financially. But I remember that there was quite a few doctors there that started asking me questions why didn't you actually apply? And for me, thinking back, it was this guilt. I would get patients that I would interact with, and I wanted to be able to provide medical services, but I was just on the administrative standpoint. So my role was limited and I wasn't feeling fulfilled. So I talked to my mom and I let her know what I was feeling and the guilt that I was feeling about no longer being able to provide for them. And so she told me that I was crazy and that I need to apply. And so I went ahead and started doing research on WesternU, and there was a preview day that was available. And I remember that it was Dr. Thrush that was talking about the MSMS program. And I thought, that's the one that I knew, okay, this I'm very interested in. And then if I get to work with Dr. Thrush, that's even better.
The MSMS program generally looks at students who certainly have an interest in the healthcare fields. We look at students who, with their background, are underrepresented in medicine. So we look forward to having students that, when they finish, will go out and serve the communities from which they came.
Well, I think it's very important when you look at those 19,000 applicants for the university that your student body reflect not just grade point average or test scores, but also the diversity that exists in the larger community in which they're going to practice after they graduate.
They always had an open door policy. It was that throughout all of our faculty. I knew that we could always go to them if we needed to. If they weren't available, we could shoot them an email and they would respond very quickly. You realize what you have is just a great opportunity that isn't readily available in other places.
I felt like the faculty and the staff and the admin, they weren't these people that you couldn't communicate with, or that they were higher up, and we were all on our own. It was really all of us were together in this.
We've had 2 students matriculate after completing the MSMS program. And in each case, these students have become leaders within their class, leaders within our professional environment.
We have some very good students who've come out of the MSMS program, not only academically, but they've formed the core of many of the student leadership positions within the College of Dental Medicine and at the university level.
It flew by. It was a year long, so we went ahead and applied, feeling really nervous about hearing back from the DO program. And by the time that we graduated, we had known who would be going into the DO group, and so it was a really amazing feeling that again we would be able to go through medical school together. When I think about graduating medical school, it just makes me see how far I've come. It was one of the happiest days of my life. I am a family medicine resident at Long Beach Memorial. Currently, working in cardiology, doing my rotation there. Anytime I get the opportunity to be in clinic and work and see my patients is what makes me really happy.
It's a medical school that's the 10th most applied to medical school in the United States. It's got a dental school that is more selective than a lot of institutions that have been in this area for more than 150 years. And the list goes on for each of the colleges, whether it's the veterinary college, nursing, allied health, the folks who are the first in their family to go to a professional school. Well, scholarship money is critical for that.
If I think of WesternU, it's always just the community feeling. I really appreciate that, and I really love that about it.